Hello and welcome to Sightwork. I'm Dr. Amanda Barker-Assell. I started this practice in 2008 as an alternative practice to my primary care practice, and it has been a fulfilling and wonderful experience. Here in this clinic, we think about vision a little differently. In a regular primary care clinic, we think about the eye as an organ. We look at specific things like visual acuity and do you need glasses or contacts, and do the structures of the eye look healthy, or is there a disease process? But in here, we think about the visual system and how the eye collects data and sends it to the brain, and what does the brain do with that information? We do a battery of tests that includes both oculomotor and visual processing. What that means is, for oculomotor skills, when the brain tells the eyes to move, how do they listen? Do they obey? Do they move together as a team? Or do they have a problem with how they move in a certain sequence, or with convergence or focusing system? We identify areas of concern and work through therapy to help individuals learn how to use the eyes more proficiently so that they can capture more accurate data. That's really important for how we spend time in the world and make decisions about where we are in space, where we may put our hand to catch a ball, or where we may hold our hand to form a letter when we're writing. The second area that we look at is visual processing. Visual processing is done in the back of the brain called the occipital lobe, and what happens there is the eyes collect data, they send it to the brain, and the brain makes sense of that. It's what we use to make decisions about most everything we do in a day-to-day basis. It helps us to understand our letters reversed or oriented properly. It helps us turn words into meaning so that we understand that if we see a word that says C-A-T and that says cat, and that we can look at a cat and identify that object. We also use visual processing to convert words from sentences and paragraphs into a moving picture so that we understand reading comprehension and we can actually answer questions about what we've read. In this clinic, what we do is evaluate all of these areas of visual processing, from laterality and directionality up to reading skills and comprehension. We evaluate strengths and weaknesses and identify a plan that is in conjunction with all your providers, from your therapist to your surgeons to your primary care doctors. We work collaboratively as a team to give your child or you as an adult the opportunity to use functional vision in a way that is meaningful to you. This is considered behavioral vision, and it is an exciting profession, or part of our profession, that I get to participate in. We see children, we see adults, we look at learning-related difficulties, or work with children to do better in certain areas with regards to reading and learning. We work with children with strabismus and lazyeyes, and also with patients after a traumatic brain injury, which may include a concussion and all sorts of other areas. We look forward to answering questions for you as needed. Please go to our website at www.sightwork.com. If you need us, we are here and look forward to serving your needs.